And, in menopause care, and I would imagine the sexual dysfunction that associates with older patients, obviously those are very vulnerable positions. How do you set them at ease when you first meet them?
I think that's something that, I really enjoy. I really like that part of it. I have a lot of patients, men and women, but first, as far as the women who grew up at a time that it was not appropriate to discuss those things. It was not something you talk about. I have patients that I see that will tell me their backgrounds and that they never knew things about their own bodies because it wasn't something to talk about. And so, I try to always just make people feel comfortable and talk very matter of factly, but understanding where they come from and letting them know it's okay to talk about it. And while I understand and it's okay for them to be uncomfortable, it's what I do all day. It's what I do all the time. I'm not uncomfortable. There's nothing they can tell me or say to me that's going to shock me or surprise me or make me question them, and that it's all part of their health, our sexual health, our mental health, our physical health. Those are all part of our health. And so I find a lot of women in particular, when I talk about these vulnerable things and I acknowledge that I know it's vulnerable, but I'm here and I'm happy to talk about it. They feel more comfortable. And I've had many men that will say to me at the end of a visit, wow, thank you that you really made this comfortable when I did not expect this to be a comfortable conversation. Or that when they made the appointment, they didn't realize I was a woman and that they were surprised at the end of the appointment how comfortable they felt talking to me because it's just very natural and it's not something, and I think there's a difference between saying there's nothing to be embarrassed about and acknowledging I know it can be embarrassing because I think sometimes when we say to someone, there's nothing to be embarrassed about,